right, thank you everyone for joining us for today's learning session. This is the second session in a three-part series. So we are grateful for you to join us again. We are recording the session today, so you will be able to have all the slides and share the recording with anyone in your practice that isn't able to attend today. Just a reminder, there's no relevant financial relationships to disclose. And we want to thank the sponsors of the project, EMS, for their generous funding so that we can do this important work. As a reminder, these are the practices participating in the project. If you wouldn't mind to please be sure you put in the chat your name and your practice. That helps us just keep track of attendance today, and we'll try to remind you to do that throughout the learning session. Today's agenda is really focused all around data. We're spending this entire time talking about it because it is such an important part of quality improvement. So Dr. Denny is going to talk a bit about why it's so important and what we do with it. And then I'm going to get into just like excruciating nitty-gritty detail about entering data for this project. And I will annoy all of you with all this detail, but I promise in the end it'll be really helpful. So, Dr. Denny, I'll turn it over to you.
Okay, great. Thank you so much. And thank you everyone for being on. I know what it's like to be in a busy practice and then have to spend your lunch hour doing this. But I really, number one, think that all the information that Kristen's going to go over, you will find it's so helpful as you start implementing this into your work. And then I'm just really briefly going to go over, why is it that we are asking you to do this tracking of data, and why is it important? Go ahead and do next slide. Okay, so these are sort of examples of what you're going to be seeing throughout this learning collaborative. You're going to see your baseline data, and then also once you implement the screenings and the counseling, and you're going to get this report. And for any of you who have not engaged in quality improvement work, really the thing that's really neat about quality improvement is, and I know everyone kind of like inwardly cringes when we say QI and key driver diagrams and all that QI stuff, but in reality, like, we always think we're doing the right thing. We want to do the right thing. Like, that's part of what we do. But if we're not measuring it and we're not looking at data, we don't really know that we're doing the right thing. And so as my strength coach always tells me, if you're not assessing, you're guessing. And like, that applies to so many things. And I think that it's really true in this instance as well. If we're not measuring it, then we're kind of guessing as to what we're really doing. And when you get this data, it's not at all meant to be punitive in any way or to call people out. It is to show you how the changes that you are implementing are impacting your data. So, when we talk about PDSA cycles, maybe you do one PDSA and all of a sudden your rates of screening and counseling go way up. Okay, awesome. Then that's like a test of change, right? That was an effective change. You may do another PDSA and the numbers drop. Well, that's really helpful information to know too. And if we're not measuring accurately, then we can't know what kind of impact our changes are making. So you may do that second PDSA, you see your numbers drop and you're like, oh, okay, well, that didn't work. So let's move on. That's the nice thing about QI and measuring things consistently and getting your data back on a consistent basis. If we just did baseline and then we did it like 9 months later, that's not super helpful for you because you're not able to do those little tests of change. We're going to be giving you data every month that really helps you inform you as to how the changes that you're implementing are affecting your family, your rates of discussion, and hopefully your whole practice. Next slide. I think that actually may be it for me.
Yep. Yeah. So now we'll get into just a little bit of the nitty-gritty of data. So really, we've broken this down into 4 main buckets that we're going to talk about today. Some of these you've already done or been working on, but confidence data, your pre-work survey data, baseline data, and then monthly action period data. So I want to reiterate, like we talked about in the first session, it really does take a team to do the project. It's much more successful It's much easier to implement and it's much more effective when you have a team working together. It's the same way with data, and as we talk about that, that'll become more clear. So the confidence data, again, many of you have already completed this. This is a really brief, I'm talking like 1 minute to complete survey that we will do prior to the project launching, midpoint, and post after the project ends. That just tells us how you're feeling about implementing and doing many of the skills that are in the project. So most of you have already completed the pre-confidence survey. If you haven't, the link will be included in the follow-up email. Please do that as soon as possible. We want that to be completed by the end of September. We'll do the mid-project check-in in January, and the post-project will be completed toward the end of May, early June. I'll send you reminders. You don't have to worry about remembering those dates or anything. You'll get reminders from me to complete those for you and any other providers that are participating in your practice. Pre-work survey data, again, many of you have already completed this or have been working on it. This is a little bit lengthier. It probably takes, I don't know, between 10 to 15 minutes to complete roughly. And it's a very brief survey that really tells us more about your practice. And usually the best way to do this is sort of a combination of the lead provider with the assistance of the office manager or administrator, because it does ask some patient volume questions and those type of things. Again, if you have any questions about it or any trouble completing it, just let me know. It's due by the end of September, and again, I'll make sure that link is included in the follow-up email. Baseline data that Dr. Denny mentioned. So the purpose of baseline data is to really help us understand what you were doing at your practice prior to the beginning of the project. So, and that's where you saw those kind of run charts where you see baseline sort of usually starts down here and then grows nicely, because many of the interventions in the project you aren't currently doing. The way we do this is chart review. Again, everybody hears chart review and goes, oh no. It's really very quick, easy, straightforward, and simple. And again, I'll send you all of this information in a follow-up email. But what you're going to do is for each provider that is participating, 7 charts will be randomly selected from the dates that are indicated. And then there is a link and it walks you through entering it. And it's really simple questions such as, was a depression screening completed? Was a suicidality screening completed? Was any type of lethal means counseling provided and documented? So it's very, again, quick. It probably takes 1 to 2 minutes to do each chart. So it's going to end up being about 28 charts per provider. So what you should start doing now is just think about who's going to do this. Is the provider going to do it? Is there a medical student or an MA or someone else in the practice that might be able to do this? We'd like to have baseline data submitted by the end of October. And again, that will be something that I follow up with you on email on to make sure you have the link, make sure you have all the details, and make sure if you have any questions, you can let me know. It is easier, I think, in doing this to, sit down and do the 7 charts for October. And then maybe the next time, try not to get stop in between doing charts, because then sometimes things kind of can get entered incorrectly. So again, if you have any questions about that, I'm happy to work with you on those. And then kind of the big data, the thing that we really utilize a lot throughout the project is what we call the monthly action period data. So the purpose of this is it really helps us know if the program interventions are occurring and what the parent and caregiver reaction is to those interventions. So the provider and clinic staff will be entering some of the data, and this is where you're going to use your iPads. And then the parent or caregiver actually enters some of the data as well. And so the iPads, which I brought one with me, you all should have. If you don't have those, please make sure you let me know, because we wanted you to have them even for today, so you can look at them as we talk through this. So the iPad data entry will occur after every age 12 to 21 preventative visit. So a well visit, a sports physical, and we want that to start on October 1st. We don't expect it to be perfect on October 1st or even during the month of October, but it's the time to get started so that we can work out the kinks, and again, kind of get into that process. So what we look at monthly are rates. So we look at, what is your rate of completing the data collection tool? What is your rate of depression screening? What is your rate of suicidality screening? So obviously to do that, we have to get that sort of total number of preventative visits that you've had for that month. So I reach out and ask that. It's usually the practice administrator or office manager that provides that. So again, now's the time to start thinking about that. Who's going to be the person to have that like total number, that denominator for me, that I can get that from fairly quickly after a month ends. We also just go ahead and ask that that's provided by provider, because while we report the data to you at the practice level, if we see that you're struggling with something, sometimes it does help to look at it by provider. So it's just best kind of from the get-go to provide that. And again, I'll make sure all of that's lined out in an email and crystal clear. So we get that by the 5th of the following month. So in other words, when we start to look at your October data, like the beginning of November, I'll be emailing to say, hey, could Sue give me, your denominator number for October? And then that is what helps us run those charts. So the quicker you get that to us, the quicker we get data, the quicker we know how you're doing and can make or implement any changes. One thing that I want to mention, and I think I do have this for most everyone, but if you've not given me the names or credentials of any of your providers that are participating, please do that, because when you're entering data, that's one of the things in the iPad that you'll be entering. So it's entered by your practice and by provider name, and I have to make sure those are loaded in so that you have the proper selections. So I just wanted to give you an idea. I'm not going to go through all these, but these are the monthly data run charts that you will see, and they'll look similar to what Dr. Denny showed you earlier, or that little box that's kind of up in the right. Oh, I see Dr. Denny has her hand up. Yep.
I was just going to jump in and say, I don't know if you have a date, Kristen, that you're asking for baseline data to be submitted, but I would just say, if you can get the baseline data chart reviews in before you start this project, it will make things so much easier on Kristen as well as on your team. So that's something that you can do now. You can do those chart reviews from last year and get that data in sooner rather than later.
Yeah, so we gave them a due date of October, but obviously if you can get that done sooner than that, that's fantastic. I just know we just now are going over it sort of in detail. So we wanted to give you, a little bit of time to be able to do that. But Dr. Denny's right. The sooner you get that done and out of the way, the better. So, and I'm happy, like I said, to help and talk through any of that. So like I said, these are going to be most of the monthly charts that you're going to get, and you'll see them for your practice. You'll also see them for the aggregate for the project. One thing I want to mention is that number one chart that you're going to see, that data tool completion rate. That affects everything else. If you don't get data entered, we have to assume you did not do any of the interventions. So in other words, if you have 100 patients that come in to the clinic in a month for their well visit or preventative visit, and you only enter data on your handy dandy iPad 50% of the time, then all the other metrics for the project get based off of that denominator that you have. So your screening rate is going to be at 50% if you screened everyone that you entered a data tool on. So just keep that in mind. And really in the beginning of the project, try to focus on, that process of getting your screenings done and getting your data entered. Those are really key at the very beginning of the project. And lots of the other things are very important too. I don't want to say they're not, but just making sure you get that process down to get the data entered and get screenings done is really important to kind of start with. So iPads, again,
Kristen,
make sure you have, oh yes, sorry, go ahead.
Wanted to jump in. There's a question for clarification on baseline from the chat. Is the 28 charts per provider each of those months or all together? And I thought I knew the answer, but I wanted to make sure.
So that's a total. So you would do 7 charts from October 2023, 7 charts from December 2023, 7 from February 2024, and 7 from April 2024 for each provider. And so that's 4 months, 7 charts each month. That works out to 28 total for
Thank you.
each provider. Yes, thank you for interrupting me. I can't for some reason see when a chat pops up when I'm rattling like this. So Haley's going to jump in if something pops up. So thank you for doing that. And please jump in at any time to ask questions. So iPads, like I mentioned, you should have yours. Make sure you have chargers. Make sure that they are charging. Keep in mind, you'll be using these each day that you have well visits or preventative visits. So make sure they're kept charged and ready to go. And we're going to talk about a little bit. That's part of the process, right? That's new. So think about who's going to do that, who's going to be responsible for that. Make sure you're powering on your iPads and you're getting them on your clinic Wi-Fi. That's one of the most important things too, that you are able to connect to Wi-Fi and you've got them connected. And as you see, really highlighted kind of on the little picture over here, there's really 2 buttons you're going to use, that top power button, or it kind of puts it to sleep, and then the home button down at the bottom. All right, and this is sort of just a picture of what the front of your iPad's going to look like. You don't have a lot of options to choose from. And that little SIS button kind of down at the bottom of the screen in the middle, that's what you click, and it pulls up the data entry tool, which I'll be showing you in just a minute. So one thing we're going to do is we're going to kind of put most of the things you're going to do in the practice together in kind of a flow. And I'm going to give you these slides, but I'm also going to give you kind of this template that you can use actually when you're doing your workflow for your clinic, and that you'll use to submit to us for your workflow. So we're putting up together screening. Now the lethal means restriction discussion part, we obviously are going to have that learning session in a couple of weeks. So you're not expected to kind of, already be up to speed on that. That's kind of an additional part we're going to work on. So don't worry so much about that at this point. And then giving the Store It Safe resources, which will be on their way to you, and then entering that data. So these are all the kind of big areas that are newish and that you're going to be putting into place. So when you take a look at this, I put this all together to just, in excruciating detail, put everything on one sheet for you. I'm sorry. I'm not going to go through all of this right now. You're going to have this, though, that you can tweak, again, for your clinic workflow, and we're going to break this all down as we go through the next few slides. So when we're talking about, again, this workflow, it goes back to that concept of team and teamwork. We're going to talk about some activities that it might be best for your front office staff to do. There may be some activities then it's best for your clinical staff, your MA, nurse, in the practice to do. And then some activities that the provider, the MD, DO, nurse practitioner will be doing. We're giving you kind of a recommendation. We're giving you something that we've seen work well in many practices. It's not to say that this is how your practice will do it, because every practice is different. So it's to give you some ideas and think about this process and the tweaks that you might want to make for your practice, or you may want to do it just like this. You may say, this works really well. So for your front office staff, what may happen when someone comes for a preventative visit that's age 12 to 21? Obviously, you're going to need some type of flag, some type of indication of, sorry, this is an age 12 to 21 preventative visit, and we need to do some things differently, or things that we know we need to do for this patient. So your front office staff might check that the iPad is charged and ready for the day when they first come in. Then at check-in for that patient, they may give them the depression and suicidality screening for them to complete in the waiting room. And then at the end of the day, they may double check that all the iPads are in the proper spot and they're charging. And that may be all the activities related to Store It Safe that your front office staff needs to do. Then some ideas with the clinical staff. Again, when a patient has arrived for a age 12 to 21 preventative visit. The clinical staff might they might be the person to pick the iPad up from the designated area. They may collect and score the screenings. They may start up the iPad by pressing that home button and the SIS icon. They might complete the screening data entry on the iPad, and I'm going to show you what that looks like. It's not the actual screening. It's was a screening completed and what was the score, basically. They may then room the patient, and they may press the button on top of the iPad and put it to sleep in the room for the provider, for when the provider comes in. So part of your data entry has been started already by the clinical staff. It's not complete, but it's been started. And then the provider would sort of take over from there in terms of the appointment and the data entry. So they would press the home button twice on the iPad after they've done their appointment, or I'm sorry, before they've done their appointment. They might review the screening results because they will be there on the iPad. And now this is one of those where maybe that's how you review the screening results. Maybe you do that a little differently, but they are on the iPad. They are entered there by the other staff, potentially. Then you would complete the visit, including having the lethal means discussion, discussing the storage safe resources, providing those, offering the safety lockbox, and giving those to the family if they want that. And then you would push the home button and complete sort of final data entry and submit that. And you'll see when we're entering the data, then it will give you a prompt to ask if the parent or caregiver is present at the appointment. If they are, there's a dark blue button. If they're not present, there's a dark blue button that you would press, and you're done. The iPad will refresh itself back to the back for the next data entry. If the parent is there, you would push the light blue button, and then it would take the parent to their voluntary kind of post-appointment feedback survey, and it does have a description on it, which I'll show you that in a minute, where it explains what the purpose is and that it is voluntary. And you can use some of that similar language when you're asking a parent if they would be willing to complete that. The parent or caregiver completes the survey, and then they press the submit button. One thing I'll mention, it's very helpful if the clinic staff or the provider, whomever is kind of there at that final piece, just make sure that that submit button was pushed and that the iPad is refreshed. Because if that submit button is not pushed, that's one way that we can lose data. So that's just an easy sort of quick check. Again, I go back to this. Everything's kind of put together on this that you are going to have to use to tweak for your own workflow. And that's kind of one of those first sort of quality improvement assignments for the project. And you'll be able to use this and tweak that to submit. So we're going to go through a case, and I'm going to show you kind of the data entry. And then I think that'll help put all this into perspective, and you'll really realize it sounds really complicated. It's really not. It's super simple. So Rose is a 13-year-old white female who comes to your office for her annual visit. English is her and her family's chosen language. She has Medicaid insurance. Her mother brings her to the visit. She checks in at the front desk and completes the depression and suicidality screening. She scores in the at-risk mild range for depression, and no potential risk is identified for suicidality. Rose does not currently have a treatment plan in place for depression. Based on her depression screening results, you schedule her back to do a more thorough assessment of her depression and discuss treatment options. You discuss all lethal means restriction with Rose's mother and offer her a safety lockbox. Her mother declines the lockbox as she already has unsafe items locked away. You forget to discuss or offer the storage safe resources to Rose and her mother. Rose's mother agrees to complete the post-appointment family survey. So this is what your data entry is going to look like. And this is why I mentioned it's very important for me to have the names of your providers. So also, just to let you know, if there is a provider or someone entering data in your office that needs a different language, we do have a drop-down box where that can be selected, and it will change this so that it reads in that language. But I'm going to pick that I'm at Farallon. The the provider that was seen today was Dr. Mudd. You would select the date. The patient is 13 years old. The patient gender identity is female. The patient's ethnicity is not Hispanic or Latino. Now, the way that you enter this, it may be because this is in their chart. It may be what you know of the patient. This is also entered in the family survey. So the family also enters what the patient's ethnicity is. The patient was white. The patient had Medicaid. This will take you to the next screen. This is where we talked about an MA or a nurse maybe entering. Was a depression screening for depression completed using a PHQ-A, PHQ-9, or PHQ-8? If the answer in her case was yes, and she scored at risk, she was assessed for suicidality with an ASQ or Columbia. There was no potential risk, and you go to the next screen. This is where in our sort of demonstration or our scenario, the MA or nurse, the clinical staff, would stop entering data. And this is what would be on the iPad screen for the provider when they came in. This is where I said you would see the results. So you would see that a depression screening was at risk. You would see that there's no risk in the suicide assessment. And then the provider begins to enter data. So please select all items that you discussed with the patient. When we talk about the lethal means restriction counseling, we're going to be talking more about this. But this is where you would say you discussed all of these items needing to be locked away and inaccessible. Did you discuss the resources? No, you forgot that. Did you offer the resources? No, you did not offer them. Was the family offered a lockbox? Yes, they were. Did they accept? No, they did not. The reason you can say lethal means was already locked away. Based on the results, what was done? This one sometimes can get a little tricky, so I gave us a little tricky situation so that we could go through that. So really, no treatment plan was indicated. Well, that's not really true because she did have mild risk. The patient already had an established treatment plan and no change was made. No, that wasn't. She didn't have a treatment plan in place. Some changes were made. There weren't changes made. A treatment plan was indicated. No established treatment plan and no action was taken. That's not really accurate either because you did take action. You scheduled her to come back for a follow-up to develop a solid treatment plan. So the selection really would be that a new treatment plan was initiated based on the results of the screening or assessment, or the other option is a new referral was made. And then what treatment plan or service was provided? It's close primary care follow-up because you didn't do a referral, you didn't start medication, you did not send to the ER, or you did not continue an already established treatment plan. Again, if you get into some nuances here, you can click other and explain that briefly. So don't feel like you can't do that. And then there is a parent present. So we click yes for that. If there's other information you want to share, we do look at this. Sometimes there's information that helps us think of things we have not thought of. So feel free to do that. And then you hit submit. And when you hit submit, that data is collected. These are those two blue buttons I talked about. So there was a parent caregiver, so we're going to press that button. This cues the iPad up for the family. So this would be the point that you would pass the iPad to the family. They can read this description, which we kept it very brief, but it's really to help us with assessing kind of care. Nothing is going to be done with the feedback in terms of, giving answers to providers or any of that thing. So it reassures the family, what really the purpose is. We also have this drop-down box again, so that if you have family where a parent or caregiver where English is not their first language or they're not comfortable with English, they are able to select the language that they need. And then again, it's very quick and easy. The family would say Farallon, Dr. Mudd. They would identify the youth's gender. They would identify the youth's ethnicity. And continue these questions. It really just gets into what was discussed with them. Did they get any information? How likely was what was said today making them change? It might be 0 through 8. Has anyone outside of the youth's healthcare provider talked with them about the risk of having guns, medications, and or alcohol not locked up? And then they can provide any information. And then when they hit submit, like I said, it's done. And on your iPad, it will refresh. I think it did on here as well, and go back and be ready for the next one. You don't have to do anything to get it ready again for the next data entry. So I'm going to stop there and see if there's any questions before I go on to the next slide or anything that's come up in the chat.
Nothing from the chat at the moment. If I see any pop in, I can read those off.
All right, great. So, couple of things to remind you of for homework. You're going to get an email from me, and it's going to have all of this kind of information for you, any of the links that you need. If you need resources or that family survey in any language other than the ones we've listed there, please let me know that. Your English resources are in the process of being shipped to you. We're having those, though, translated into these languages. These are the languages that you all provided to us when you registered for the project. So if any are missing, just shoot me an email and let me know. We'll make sure that that option is on the survey for families to choose. We'll also make sure that you get printed resources in that language. So let me know that as soon as you possibly can. You're going to be completing that workflow that I talked about and submitting that by the middle of October. Again, you will have these slides to work from. You will also have kind of that templated flow that you just can jot notes on. You can type and change it in PowerPoint. You can type out your own workflow. However you want to do it is totally fine. But I just wanted to try to make that as easy as possible for you. So that's really, your first sort of QI type of assignment. Be sure you've completed that pre-work survey. Work with your office manager or administrator on that. Be sure that all participating providers have completed the pre-program confidence survey. Again, I'll make sure you have that link at the top of your email in a follow-up email. I mentioned about having the names and credentials of all your participating providers to me. And then, as we talked about, start planning for entering baseline data. Again, think about who's going to do that, how you're going to get that done, and let me know if you have questions. And then remember that October 1 is our start date. It's not that is everything should be done and everything should be running perfectly. It's to get us started. So on October 1st, have that plan for making sure those patients are identified for doing the Stewart Safe interventions. I think Haley has her hand up.
Yes. So we have a question in the chat. What about double or triple well-child visits where more than one child is being seen simultaneously? How does iPad entry accommodate for that?
Okay. I think that, and I'll let Dr. Denny chime in, but it would be 2 separate data entries on the iPad. So someone maybe your clinics should have more than one, unless you just had one provider. If you have only one provider, you'll only have one iPad. But if you have more than one provider, you will have multiple iPads. So, you could use 2 iPads to do that, or you'd have to go through the data entry for one patient and then enter it again for the second. Dr. Denny, unless you have any other ideas. Because I'm assuming
I
these would be
agree.
like siblings. These would be
Yeah.
siblings probably. Yeah.
Right, because you're going to screen each one anyway. And so you would screen them all, and then each data, like when you're reporting out, would be separate.
I would think the family feedback survey, though, you would just give that one time.
You could give that one time, correct. Yes. That's a good point. Thank you, Haley. And again, that flow would look a little different than what we've talked about, because obviously you're going to, if you had 2 iPads, you could do the flow exactly like we talked about. But if you only have that one iPad, then you may need to just enter it all for one patient, do the family survey, and then enter it all again for the next patient, but not do the family survey. Good question, though. Other reminder, we have the third, I'll call it episode. I don't know if that's the right word, but sort of our third session in our three-part series coming up on October 9th from 12 to 1. We do make that one an hour. I know sometimes it's hard to kind of get wrapped up and hear at exactly 12. If you can't, come when you can. We'll be recording it. This is going to be a really different session, though, than the first two. This is really drilling in to the meat of the project, which is how to have those lethal means restriction discussions during your visits. And you're going to get a lot of great input, a lot of great information. There's a virtual reality platform that we use. We bring in colleagues from Cincinnati Children's, and it's really great because it helps you kind of deal with I'll just say a non-cooperative or just a avatar that's saying, well, yeah, I have to have a gun. I can't lock my gun up. I have to have it for my safety. So kind of how you handle that, you get to kind of see that in action. So we would love to have as many of your participating providers attend as possible because they're going to get to see it, live. They're going to get to practice it live, try it live, see other people do it, get feedback. It's a really great session. So we will record it, but it's kind of not the same as if you're there. So try to see if you can get your other providers who are participating to attend that. Wanted to remind you about annual meeting that's rapidly approaching on October 18th at the Hilton Polaris. We would love to see you there. As a reminder, if you are an Ohio AAP member, it is free for you. So we have the QR code. You'll have that in the link in my follow-up email if you want to register and join us. And then Store It Safe, as you know, September is Suicide Prevention Month, so we have a campaign that we have been working on to raise $90,000 for Ohio AAP's 90 years, to use all of that money to continue expanding Store It Safe and continuing offering the great resources that we have. So you will have these codes too if you wanted to donate and wanted to share and spread the word. And those, I think I made it through with 8 minutes left. That was a ton of information, I know, and some of it was incredibly detailed. So we do have some time for questions if you have those or anything you wanted to follow up about.
This is the kind of thing where once you get into it and start doing it, you may have more questions. Please
Totally.
don't wait for the next action period call. Reach out. Kristen has been through this many, many times, and she's helped practices troubleshoot all kinds of different issues. So shoot her a text, shoot her an email, do a quick phone call, but
Yes.
Please don't hesitate to reach out sooner rather than later.
Please, and I'm serious when I give you my cell phone number for text. I mean, I love text, and my 13-year-old daughter tells me I'm very yappy in both text and word, so I am. So please, if you're struggling, send me a text. I'm also happy to hop on the phone with you at any time to answer questions or talk through anything. Like Dr. Denny said at the beginning, it's some little things can get tricky, or you can have a question about this or that. It's better that we resolve them when you have them, and they're usually super easy to resolve, and then you move on. So, but please think of me as available to you to answer questions or help. I'm happy to do that. All right. If there's no other questions in the chat, Haley?
Oh, no other questions have come in.
Okay, and for anyone who joined us late, just please make sure before you sign off today or I end the call that you pop your name and your practice into the chat. That helps us just keep track of attendance. So please make sure you do that before you sign off. And again, so excited to have you all join us for the project. Your resources are heading out to you. Your lock boxes will also be heading out to you, so you will have those. I'm shipping those out they'll come out in like boxes of 5 lock boxes, and you'll get like 20 for the first round. You just let me know when you get low, and I ship more. They usually, the way we ship them, they're usually to you within a day. So that way you don't have to store a lot of stuff, but we have them all here on hand ready to go. So those will also be going out to you tomorrow. All right, with that, we will say goodbye, and we will look forward to hearing from you with any questions and looking forward to our final session on October 9th. Thanks, everyone. Have a great day.